At the Johns Hopkins Huntington Disease Center of Excellence, we provide comprehensive clinical services, including a meeting with a social worker, our genetic counselor, and a multidisciplinary clinic. So for those who want to be tested to see if they have the genetic mutation, we provide genetic counseling as well as comprehensive neurologic and cognitive assessments. And our social worker meets with every family and meet them where they are in terms of what their needs are. And we also provide the multidisciplinary service in which the patients come and work with the neurologist, the physical therapist, occupational therapist, and the speech therapist so they can get all the services in one visit. And in addition, also very importantly, we provide clinical trial opportunities. And again, that depends on whether the patient is interested in observational studies or clinical trials, which are testing out experimental drugs that may help with various symptoms of HD. While we have a lot of effective treatments, as in medications that help the symptoms of HD, there's still a lot of room for other symptoms of HD that can use medication help. And also, as our knowledge about the genetics of HD advance even further, including gene-based therapeutics, we're working on slowing down the progression of the disease. And to see if the drugs really work, it doesn't just take the research team. It takes the joint effort of both the researchers and the patient volunteers. So in order for us to see if a medication truly is helpful, a very well-designed clinical trial is the best way to determine whether our hypothesis about the drug working is the case or not. So it's very important for us to work with people who do have the genetic mutation for HD to volunteer to take these medications or placebo to help us answer the question based on what we already have learned so much about a specific experimental drugs through animal studies, for example. Is this truly going to help our patients with HD as well? So it's very essential for us to work together. Generation-HD1 was a clinical trial where we studied a drug called tominersen, and it's a gene-based drug that's designed to lower the amount of the Huntington protein, the mutant form and the regular form of it, to see if it helps slow down the disease progression and improve the clinical symptoms. Unfortunately, that trial did not show a difference between the drug and the placebo, but after the data were analyzed, it appeared that for a specific subgroup of the participants, that the drug may actually be helpful in leading to clinical improvement. But we can't just find something after the fact that was not part of our initial hypothesis. So we have to run another trial that's specifically geared towards that subgroup of people for whom it looks like there was improvement over placebo. And that specific subgroup of people from HD1 happens to be those who are on the younger side and those who have had shorter disease duration, and those who received the drug less frequently. So based on those data points, HD2 trial is now happening, and the difference, some of the major differences between HD1 and now HD2 are that the HD2 trial involves a lower dose of the drug, and it involves the less frequent dosing. So it would be a drug injection of every 4 months, and it's targeting those who are on the younger side in terms of their disease duration or and age. For the Generation-HD2 study, we're looking for people who are between the ages of 25 and 50, and those who are in the earlier stages of the disease, and those who can undergo MRI of the brain. And so if someone is feeling claustrophobic, that would be difficult for that person to undergo MRI. So one has to be comfortable with getting the MRIs done. And also those who would be comfortable with and can tolerate lumbar punctures, also known as spinal taps. As we're recruiting those who are on the younger side, those between the ages of 25 and 50, we fully acknowledge that people are busy with their lives. Most people in that age range are typically still working. They have maybe childcare needs and many other demands in their life. So we have designed the trial to really try and accommodate those very busy lives. So, for example, the trial was designed so that the visits are occurring only once every 4 months. And so that's a much less burden than it could be otherwise. We also are able to provide assistance with getting FMLA time, for example. We can provide medical notes for the time that the participants are missing from work by being in the trial. And the study also provides accommodation, such as lodging and transportation costs. And so whatever the needs are, we are ready and committed to work with families to our best to accommodate. So it's very understandable that once you're in a trial, is that it? Is that all you can do? And you'll be excluded from other trials. Just first of all, that has been an issue until recently with HD1 participants, that if they weren't in that trial, then they were kept out of other trials. But we're starting to see that other trials are starting to allow these participants from HD1, and we certainly hope that will continue to be the trend. And so if that's the trend, just like other previous trials, there's usually a waiting period where once you finish one study with a specific drug, there's a time you wait for that drug to wash out of the system until you're able to participate in another trial. Given the trend of the gene-based therapies continuing to progress, and we're advancing our knowledge, and other types of therapeutic targets are being developed, it's very likely that we might need to administer more than one kind of drug to treat HD. So hopefully the trend will continue, that participants from gene-based trials will be allowed to enter other trials. So if you are interested in a trial, but for whatever reason you don't qualify, we can certainly understand the disappointment of being, not being included. But we're a community, and this is whatever study we do is for all the members of our community. So if you don't qualify, it's very important to look around within your family, for example, or within your own community, and see if there are other people that you know of who may be able to participate in the study. So if you're not able to participate, we're happy to answer any questions for anyone else you may think of who you think may be able to join the study.